Have you guys found that your staffing turnover rate has improved since the unionization?
Temple has very, very low turnover, a highly educated staff, and a skill level that is just absolutely incredible. This is a place where people want to come to work because they're working with other nurses who are so highly skilled. And so, the contract has really served our community, our patient population, as well as our nursing staff.
What is your turnover, if you know about?
It's less than 1%, and that's in the poorest zip codes in the entire city of Philadelphia.
That's incredible.
Yeah.
So our turnover rate also went down. Before we had a really hard time competing with Temple and with Penn because of their rates. Their rates of pay were so much better than ours. Because of the contract and the wage scale that we did negotiate, our turnovers have actually gone down tremendously. Now the people that are leaving because they got their advanced degree, not because they're going to be with another healthcare system.
At Hahnemann, when I started there 6 years ago, we were among some of the lowest paid nurses in the city. Once we unionized, our pay went up very dramatically, and at least in the ER, we noticed quite a significant change in how many people we were losing. Before we unionized, we would just hemorrhage. We were always training new people, just hemorrhaging nurses, training them for Temple
And you also went through an organizing drive where you got a raise during the organizing drive, right?
We did. We called it our Please Don't Unionize raise. The management called it a market adjustment. We did actually, it wasn't just a promise, we did actually receive it before we voted, which we all happily accepted. And then we voted yes for the union and got even higher raises in our wage scale that we negotiated at the bargaining table.
And how much did you get?
I personally, my pay went up within that year between the wage scale and the Don't Unionize raise. Got, I would say, about at least $8 an hour more than what I was making. Significant change. They were really underpaid.